Mr Speaker, my question is to the Associate Minister of Health, Mental Health, and asks, is he aware of the decision by Tairawhiti District Health Board to award contracts for mental health services to the Challenge Trust based in Auckland rather than the existing provider, Turanga Health, and how does this decision comply with the government's policy for providing more personalised health care closer to home?
Speaker.
The Honourable Jonathan Coleman.
Yes, I am aware that Tairawhiti DHB have awarded Challenge Trust a contract for mental health services. I have been advised that Challenge Trust will be offering a wide range of services, some of which have never been offered before, and that this contract represented better value for money than the previous contracts. It is my understanding that Challenge Trust will employ local people to deliver the services, and that the contract is in keeping with the government desire to deliver more personalised care closer to home. I would also note that Tairawhiti DHB will be getting its fair share of the $174 million of new mental health spending recently announced in the budget.
Rahui Katene.
Supplementary to the Minister, what justification does he have for mental health funding cuts in Christchurch, leading to the closure of 198, the Youth Health Centre, and the Newell House Trust, a respite provider for women severely affected by mental illness, which will close at the end of the week?
Honourable Jonathan Coleman.
Mr Speaker, I can inform the House that there have not been funding cuts for mental health services in Christchurch. With regard to the closure of the 198 Youth Health Centre, 198 chose to close its doors as the DHB contract was no longer enough for 198 to remain viable in its current form. I understand that it had faced cost increases related to the lease of its premises and lost a non-DHB research contract. It's also my understanding that equivalent services are now provided by other organisations and funded by the DHB. Canterbury DHB has maintained their funding for Newell House, and it was the cessation of various past funders that the trustees said was the major reason for the closure of Newell House. Canterbury DHB received $125 million for mental health services in the year to June 2010. They will get more this year as part of the $174 million of new money going into mental health. In short, there is much more money going into mental health, but there has to be some reprioritisation of funding.
Speaker.
Rahui Katene.
Thank you, Mr Speaker. Has the Minister heard the claim from Platform, an umbrella group of mental health providers, that $2 million will be trimmed from mental health spending in Wellington and Hutt Valley DHBs, and how will the whānau of mentally unwell people continue to have access to quality support?
The Honourable Jonathan Coleman.
Yes, they have raised those concerns with me, and I've asked the Minister of Health to discuss this with the relevant DHBs. But there are 2 points to note. The first is that the mental health ring fence remains in place, protecting expenditure in mental health. And secondly, there is $174 million of new money going into mental health, of which these 2 DHBs will get their fair share. Of course, it should be noticed that the last government handed over Capital and Coast DHB with a massive deficit of $65 million, which really did a major disservice to the people in that region, and this government's been striving hard to right the situation.
That brings to a close questions for oral answer. I call on Government Order of the